Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. We are welcoming Dr. Ben Bringewald as our speaker today, and he will discuss digital implant planning, specifically with the CEREC Primescan and 3D imaging. And with that, Dentsply Sirona is sponsoring tonight's webinar. At any point during the webinar, if anyone has questions, please feel free to type them into the Q&A section of the control panel, and we'll answer them live at the end of the presentation. And Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. So with that, Dr. Bringewald, the floor is yours.
Thank you. Good afternoon, good evening, depending on where you are. So let's talk about how we want to design this. So the first thing, when it comes to digital implant planning, one thing that ideally, the way that we would like as general dentists, I'm a general dentist, that we would like to see it done is we would like to start with the crown down, start with the prosthetic approach before we place the actual implant itself. Now, unfortunately, just with the way that things work out in the office, that's not always possible. And more often than not, I think the issue is that we kind of start backwards. It starts off, especially if you don't place any of your own implants, if everything gets referred to either your periodontist or your oral surgeon, it starts off with a patient that comes in. It's established that that patient needs an implant. The patient wants to go forward with the placement of the implant. And then we kind of start in this place here. We start with the implant that's placed, and then 6 months later, or however long it takes for the implant to fully be integrated and for us to get the okay from the periodontist or the oral surgeon, we go back and we design and plan the implant at that point. Now, the problem with that is that sometimes the placement is not the greatest. So the way that we'll approach tonight is just as a general outline. Initially, we're going to talk a little bit about the advantages of a cone beam CT. Not necessarily just for implant related, but also for just generally things that we are prone to missing in just the 2D imaging. Then once we briefly go through that, the main thing of tonight is going to be talking about how we digitally plan out the implant placement with a crown down approach. So we start off with our intraoral scan full arch digital impression of the dentition using, in our case, the Primescan, or if you have an Omniscan in your office, you can certainly use that as well. Then using the Cedexis 4, which is the software that we use for our orthopos, or if you have an Axios, you can certainly use that as well. How we merge the CBCT scan and our intraoral impression, and from there, how do we design our guide? One of the things that was kind of daunting for us initially when we got our CBCT was just the sheer volume of information that we were able to acquire with that. I think as dentists, we have gotten very used to very quickly reading 2D images like bite wings, like PAs, pano axis, and we can just look at them, glance at them, and we can see anything that's amiss there, just because we have seen so many normals, especially when it comes to panoramic X-rays. So when you buy your CBCT, either if it's an orthopos through Dentsply Sirona or if it's an Axios, one of the things that comes with that was a voucher for a course through CDocs. And they have two great facilities. One is in Arizona, one is in Charlotte. The teachers are great, the facilities are great. One of the things that they taught us to kind of take a step backwards and to just make sure that if you don't want to miss anything, that you need to have a system, because now you're no longer just looking at a 2D image, you're looking at three different sections: the axial view, the cross-sectional view, and the tangential view of, essentially the whole head. So in order to make sure that you don't miss anything, the system that they developed, which has been working really well for us here at the office, is to just just go through the axial view. We go top through bottom, then we go left to right, and then we go front to back. And in those areas, what we look for is anything that's off in the sinus, the TMJ, if you have a big enough point of view, the airway, again, if it gets captured, if you have a big enough field of view, then the maxilla, the mandible, any sort of hard or soft, any sort of pathologies that could be there, and then the dentition. And I think if you follow that kind of script, then that can take some of the stress out of, the worry that you may be missing any sort of pathologies. So let's look at this patient. This was a new patient that came in, didn't really have any concerns. We took our CBCT scan, and the 2D scan looked good. Wasn't really anything there, not much in the way of restorations. But when we took our CBT scan, there's certainly the pathology there on tooth number 2. And you can also look at the sinus in that area. Things are draining into it. And when we asked the patient about it, he was certainly complaining of, frequent issues with the sinus, and nobody ever seemed to be able to figure it out. So that's something that we missed in the 2D view. This patient here came in, certainly a lot going on, but the main concern was to finally do something about replacing the missing teeth on the lower right. So when it came time to treatment plan, what we're going to do, go forward with partials, we wanted to make sure that we don't miss anything on the other side. And again, on the CBCT, that's the lesion that we found on the lower left. So now it's a entirely different conversation that we have to have with our patient. This patient came in, and again, the main concern was just the lower left, around tooth number 30, bite sensitivity there. But when we took our 3D image, not only did we find out, that there was something going on with number 19, but also at the same time looking at number 2, number 15, and then certainly number 19 with the pathology there. So those are just the things that we miss. Now, and that's just for the dentition. Now, this is the patient. She came in. She's a very nice patient, been a patient of the practice for many years. And her main concern was that she has lost her crown on the lower left, tooth number 20. In that case, she already knew about implants. She already had 2 done before. So our main concern was to try to figure out if this is something that we can place here at the office, that implant, if that's something we can place at the office here. So we wanted to see how much bone is left and how close are we to the mental foramen. So we ended up taking our CBCT, and one thing that we found was this. So that's definitely not something we would have ever caught on a PA. To us, it just looked like a calcified lymph node, but it's one of those things where we see it and it's not supposed to be there. One of the nice things about the Dentsply Sirona and the Codexis software is that it actually gives us the opportunity to work with a group of radiologists. And that group is called Dental Radiology Diagnostics. So this is a group of radiologists. If you see a pathology on a CBCT where you're unsure of what it could be, that's a conversation to have with the patient, where in her case, what we said was, we're seeing this mass here on the cone beam, and there's 2 options. We can certainly make a referral to an oral surgeon and have it evaluated. Or if you'd like to save the appointment, save the time, we can get a reading by a dental radiologist. And patients are pretty perceptive of that. It's $100. We don't, we just pass along that cost right to the patient. And usually the patients are very appreciative of that. Once we have the account set up, if you don't have a if you don't have a densoplacerona CBCT, you can certainly still use that same service. It's just not quite as easy to upload the scan. So once you have your account set up, if you do want to have something read in the densoplacerona, once you get past the exam, here it's just right in the output button, the same place where, like, let's say you wanted to export a 2D pan, or if you wanted to export your entire CBCT exam for a consult with a specialist or for the patient to take home, there's a button right here where you can upload it directly to the dental radiologists to have the scan read. And once you have it uploaded, in about 2 weeks, you get this letter back. If you want to have it expedited, you can do that for an additional fee. But essentially, you get an email back and that has the entire reading in it. And you can see here, in this case, it was a calcified lymph node, and then there was no biopsy needed at this point. And also, will view, like, you will tell them what the area of concern is, but they will not just focus on that. They will actually do a comprehensive reading of the entire scan. Now let's talk about implants. So these are the cases that when they come back from the surgeon that are just frustrating to restore, right? As a general dentist, because the implant is in there solid. The patient thinks it's time to restore it, and it is, but these are just extremely challenging, not only to restore, to get the restoration on there, but also for the patient to maintain it long term, and for the patient to keep it clean, and for the restoration to stay. Now, one case I want to talk about. This is a case that was done by Dr. Hernandez, a friend of mine down in Nashville, Tennessee. If anybody ever needs a dentist while they're down there, has an emergency or anything, he'd be a great guy to talk to. But here's a patient, came in with pain in the upper right. Patient was referred to endo. By the time he actually got to see the endodontist, the tooth had fractured to the point that the tooth was at that point no longer restorable. So the case was referred to the oral surgeon for an extraction and an implant placement. And this is what came back to the office 7 months later. So all that the oral surgeon at that point said is that the patient needed a custom abutment. And unfortunately, he was kind of left, Steve was kind of left out of the loop when it came to the planning. It got restored, and it's, with a custom abutment, and it's working, but obviously that's not the kind of placement that we would hope for. Now, most cases that we see, though, are not that extreme. Most cases that we see, I think, are functioning just fine. So we have this case here. Patient came in for a new exam and congenitally missing second premolars. The one on the lower left is doing just fine. The lower right had to be removed and had an implant in there, and that's functioning. It's been functioning well for the patient, but it was getting to a point where K was starting to break down, and we ended up taking a CBCT to see what's going on there, and at the same time to see if it's, how the bone is around K and how we can place the implant there. And then at the same time, this is what we saw. So you can take a PA of tooth number 29 right there, and you will never see that there's anything wrong with the way that the implant is placed. As long as you take a PA, you will never get that view. All you're going to see is the fact that there's bone behind the implant. This patient here came in, 3 implants were placed, functioning fine. She did have some pain on the upper right with a filling that had been placed, deep filling that was placed there. And when we took a CBCT, the tooth number 4 certainly needs a root canal. But if we look at the positioning of the implants of 5, 6, and 7, We can see, if you look at the cross-sectional view, you can see that the implant for number 5 has certainly been placed well. Once we start to move a little bit further forward, you can see the implant for number 6 is still mostly in bone, but you can see it right at the apex. It's starting to show through just a little bit. And then when it comes to number 7, that is kind of placed outside there. And again, it's functioning, but you will see that, like, long term, when this fails, or if this fails, the question becomes: is it just when you have to re-implant it? Can you just re-implant it at a different position, and will that work, or did it fail because something else was going on? And if you have a 3D image of this, then you can tell, okay, this likely failed just because of the initial positioning. So how do we avoid that? How do we avoid those kind of positions? And the best answer for that, I think, is to do the treatment planning in a way that we start with the crown. So let's look at this patient here. This patient came in, had a bridge. Tooth number 29 through 31 was the original bridge. The bridge was failing. The tooth number 31 had fractured underneath the bridge. We sectioned the bridge initially. Tooth number 31 was removed, and tooth number 29, when the patient came in to get his crown done there, he was asking how he can get some teeth back in that area there. So we wanted to see, is this something that we can safely do at the office here with a guided surgery, or is this something where we need to make a referral to the surgeon to do some bone grafting, get some bone back in that area? So when we had him back for the crown on number 29, we took, while the crown was milling through our CEREC, we took the CBCT scan. And this is what we saw. So you can see the fresh extraction site where tooth number 31 used to be. Tooth number 30 has been gone for a long time. Certainly starting to get a little bit of that knife edge ridge that's kind of showing there. But there's still some good bone there. So the next thing that we did is to plan the whole thing out. So it starts off with our full mouth impression. In this case, we would, when you open up your CEREC in either Connect or in your regular case system, when it comes time to the restoration type, you go right here to the prosthetic planning tab. In the prosthetic planning tab, you can choose the type of crown that you want, the same way as you would with any other CEREC restoration. In our case, we did the biogeneric one. And then you just position the implant going from there. Once you get your complete intraoral scan done, upper, lower, and the buccal bite, then the next step will be to get the outline of how you want your crown to emerge. Now, with the emergence profile, it's the same way as you would plan a pontic for a bridge. If you do have CEREC and you want to set up and you do 3-unit bridges with the CEREC, you will set up the same pontic design and same emergence profile, just like this, where you plan it, how you want the pontic to emerge from the gum tissue. And you can either make this bigger, make it smaller, expand it mesiodistal, buccolingual, whichever way you'd like to do it. Once you have this outline, this is essentially the same outline as when you do a crown on CEREC and you select the margins. That's the same idea. So it will use this essentially as the margins to design the crown. One word of caution: when you do design it, you want to make sure that the positioning is correct, because there's no underlying stump to guide the position. You want to double check and make sure that the grooves line up, that the cusps line up, and that it's not too far either mesiodistal or buccolingually inclined. Once you have the restoration planned and you have it designed here, you can change it just the same way as you would or any regular sort of CEREC crown. So you have all the same tools. you can adjust the contacts. You can make them lighter, you can make them heavier. You can change the occlusion. You can change the emergence profile. Anything that you want to do, anything that you would normally do with a regular CEREC crown, you have the opportunity to do the same thing with this before you even place it. Once you have your crown where you want it to be, the next thing you would do is you would export. You see that little button down here, it says export and import. Initially, what you would do is you would hit the export button, and that will open up this menu here. Now, if you have a Primescan, you have the opportunity to do both SSI files and to do SIXD files. The SIXD files are for Primescan only. And what they do is they have a little bit more, they're a little bit more detailed. I'll show you the difference in just a minute. They're a little bit more detailed, and they give a little bit more information to the CCAT implant planning software. So now that we have the impression part done, the next thing is to go back to our exam. And in our exam here, what we will do is we will look at the area there. And then first thing that we have to do is when you take any sort of CBCT is to make sure that the panoramic, what they call the panoramic curve editor, is set up correctly. So essentially, what this does is it sets up the 2D panel from your 3D imaging. So the reason you want that to be exact is when you later on navigate this image to highlight the nerve position, then you want to make sure that there's not a lot of overlap. So the easy way to do this is you take this yellow line, you move it down initially, and you set up these little dots to make sure that they're all within bone. It's a very straightforward process, but if you don't do that initially, then your panel is either going to be too squished or it's going to be too spread out. If when the image was taken, if the orientation was off just a little bit, the other option that you have is you can do the 3D align here, which essentially just allows you to change the Frankfurt plane and all of those other things, which are more crucial when you take your actual pen as opposed to when you take a CBCT. They're not that crucial when you take your CBCT because you can later align it right here in this tab. So once we have our panel all aligned, the next thing to do is to actually get into the CCAT suite. So you go in Sedexis, you go on the Tools button, and you select your suite here. In our case, so CCAT has 4 different suites. Essentially, they're just plug-in components that are part of the Sedexis software. One of them is the Implant one, which is the one that we use the most frequently. If you're an endodontist, there's also an endo suite, there's an airway suite, and then there's a TMJ or function suite that you can use as well. But so again, this, because you're gonna be in the panoramic, it's easiest to do it in the panoramic section. When you do the initial preparation, you want to make sure that that curve is set up properly. So the first thing that you do to make sure that you can merge the appointments is to select the location of your inferior alveolar nerve. So in the implant suite, what you do is up here in the prepare section, there is 2 buttons. One is for merging the impression, and one is for adding the nerve. So when you click on the nerve, you will then be able to select the nerve and to place it just where it needs to be. You want to make sure that, especially in the position where you will place the implant, it's in the right spot. And you want to make sure that you check that not only in the tangential view, but also in the cross-sectional view. That's really the most crucial view right here, where you can then place the implant. Once you have the nerve all planned out, the next step is to go back to our tab up here and to select this button right here, which allows us to add our digital impression. So there you have two file types that you can import. Just like I said earlier, it's either the SSI file or the SIXD file. The first thing, in this case, this is through the Primescan, so it's an SIXD file. You can see these are all the teeth that are there from our digital impression, and the blue tooth right there is the tooth that we treatment planned earlier, we designed earlier in our Primescan module. So the way that these impressions get merged is you can select up to 5 buttons in each arch. And essentially these buttons, they just correspond tooth to model. So you want to make sure that you select as many different natural teeth as you can. Ideally, you want to stay away from any teeth that are restored. If that's all that there is, then that's all that there is. But when you do only rely on teeth that are heavily restored with either amalgam restorations or with crowns, there is a little bit of scatter radiation, of scatter imaging that's right there, which will distort things just a little bit. So once you have them merged, the next step is to verify and make sure that the stitching worked okay. Now, this really, if there isn't too many, like I said, if there isn't too many heavily restored teeth, this really is very rarely an issue unless for some reason you clicked wrong and you selected a different tooth on the model and on the final and on the scan. That's the only time that the computer really messes it up. But usually if you check in this box down here, you can just see how the outline of the impression stitches up with the outline of the teeth there. And that is just the way that you want it to look. Now, SSI versus SRXD. So if you look at this model here, we imported it as a SSI model. You can tell the difference because this is a stone model, whereas if you do the SIXD model, it's actually tooth colored from the Primescan, and it's a little bit more detailed. So, but just in case, if you have a Omnicam at the office and an SSI model is all you can export, it certainly works. Again, you want to make sure that if you look here that all the stitching is correct, that the teeth are overlapping your CBCT well. Now we're going back to the SRXD file. You can see how we have our nerve planned and we have the images stitched together. So now the next step in the process is to actually plan out the implant. When it comes to planning the implant, because it's an SIXD, one of the advantages of that is the software already knows which tooth we designed. So you can see that little blue tooth right here. So it knows that the implant that we want to add is going to be in position 30. When it comes to the implants that are part of the CCAT suite, they have every single manufacturer that you can imagine is likely in there, along with all of their implant lines. To speed things up a little bit, when you can set up as a favorite, and you can set up only if you use more than one manufacturer at your office, you can set it up so that it's only the ones that you have at your office, so you don't have to scroll through all of the different implants all at once. The other thing that the Primescan impression allows you to do is it allows you to set up the orientation as what they call the automatic positioning. So if you look down here, you can see the orientation. You have two options. One is to just drop the implant in and then you orient it the way that you want it to. Or the other option is that it does the automatic positioning. When you do that, it places the implant right along the long axis of the crown that you have already designed. If you decide to do more than one implant, like let's say you want to also place an implant on tooth number 27, in our case here, I just selected 31. One of the nice things that the software allows you to do is you can do the orientation and you can set it up that it will actually place the implants or plan the implants as parallel to each other. So what that allows you to do is, like, let's say you are designing a 3-unit bridge. You have the option to have the 2 implants placed parallel. Or if you are designing a bigger case and you want to make sure that, the path of draw is correct, then you can set it up so that the implants are designed parallel. The only caveat with that is if once the implants get placed, when you see that maybe because they've been placed parallel, now one of them isn't fully in bone, if you change that, it won't automatically keep them parallel. So you will then have to change the other ones as well. So what are some of the errors that Codexis, that CCAT will warn you if they're happening? So they cannot warn you of anything that you didn't add to it yourself. So the only thing that the software knows to warn you about is the nerve that you marked, if you're too close to the nerve, and you can set those parameters yourself. So if you look at the box right here, the preset, I think, is 1.5 millimeters in each direction, and you can certainly change that however comfortable you are with the surgical placement. But you can see that if this implant impinges on the nerve will turn red and the implant will turn red as well, meaning the error is there. You're too close to the safety margin that you had previously set. And the other thing that it will warn you about is if you have placed 2 implants and they're too close to each other, it will also warn you of that. The things that the software can't warn you about at this point is if you're too close to the sinus. The software doesn't know that because you didn't mark the sinus. Or if you are too close, like let's say if this tooth here was, if the root was further on the distal and the tooth was tilted forward, if you're too close to the root of that tooth, the software also wouldn't know that. So you have to make sure that when you check it, you have to make sure that you check it in the different views to make sure you're not impinging on any of those structures. The next thing that you will select once you have your implant selected is the abutment. Again, it has you have 3 different options here. You can choose no abutment. You can choose a manufacturer's abutment, which in this case is what we did, or you can just choose the generic abutment. Once you have figured out which abutment you want, it will also place that in the implant, and you can see that how it's positioned right there. The next thing that the software needs is to put the sleeve in there. The sleeve essentially is just the part of the surgical guide, is that little metal ring in there for those of you that haven't placed any. It's a little metal ring in there that allows the drill to have the proper orientation. And essentially there is 4 different guides that the software is integrated with. I'm going to go over the different kinds really briefly here. There's two guides that are made in-house by CCAT. That's the classical guide and the Opti guide. The main difference between the 2 is that the Opti guide is all digital. So you don't have to take any impressions, anything like that. You can take just your digital intraoral impression, your CBCT, and that's all the information once you have a plant that they need. The classic guide, and that's the one that I would say is by far the most common one between the 2. The classic guide has an actual scan plate where you have to bite into with some blue mousse or whatever impression material, bite registration material rather, you use at the office. The only time that that's really ever used is if there is, like, let's say you have a patient that has a very heavily restored dentition and has crowns on every single tooth, then there's a lot of scatter, and then the stitching of the impression and the scan may not work as well. And then the classic guide certainly would be an indication. Or if the patient is edentulous, then that would work as well. The CEREC guide 2 is the guide that's actually milled right through your mill in office completely. The limitation for that is that you can only do a single osteotomy, so only one implant. The fourth option that's there is the DigiGuide, which is essentially CCAT provides you an STL file. And then if you have the capability, you can either print it right at the office, or you can have your local lab print it for you. If you do print it right at the office, you still have to get the little metal sleeves that have to go in there, because those have to be incorporated, or your local lab, if you choose to go that route, they might be able to place the sleeve right for you. So here's if you just go, this is right from the CCAT website. Essentially, the OptiGuide and the Classic Guide, they're produced right at the CCAT facility, right in Germany. So if you do go that route, you just have to plan accordingly, because of the turnaround time can be a couple of weeks. And that's the main difference between the OptiGuide and the digital guide, is the fact that the DigiGuide can actually be produced here locally. And then, like I said, the Classic Guide over the OptiGuide or the digital guide, you would only use if it's either an edentulous jaw or if there's a lot of metal artifacts and the software has a hard time stitching the impression and the scan together. So if you do go the route of an OptiGuide, this is what will come back. This will get mailed back. Because you already selected your implant system, it knows which sleeves to put in there. Same with the Classic Guide. This is the little scan plate and the bite registration material that comes with it. And then that, again, is just a little bit more involved. And you actually have to mail that first to Germany, and then they turn it around. Whereas the other guide, the OptiGuide, you can complete it all digital. If you choose to mill the guide in the office, then this is what it looks like. The reason it's blue here at the bottom, that's a filter that's in there, because the whole milling process, milling it out of the guide block, can be a little bit messy. So you don't want it to clog up your vacuum pump and your water filtration system of your MCX or MCXL mill or your prime mill. And like I said, the main thing is you can only have the one osteotomy site. So once you have the sleeve in there, in our case, we selected the OptiGuide, and then you'll have the different opportunities for which kind of sleeve system you want. If you don't use the Sirona one, if you have a different implant system, then those are all in there as well. So this is what it looks like all planned out. You can see the implant is placed right here. And one thing I wanted to point out is there's two different views. You can have the panorama view here, or you can go with the implant aligned view here. The main difference between the two is that once you have everything planned the way that you want it to be, you want to be in the implant aligned view, because you can actually essentially walk around the whole implant just by tilting these buttons here. Whether you're in the cross-sectional view or whether you're in the tangential view, you can walk around the entire perimeter of the implant, and you have the opportunity that way to check and make sure that everything is fully planned and boned and is right where you want it to be. So once you have everything set up the way that you want it to be, there's three different options that you have up here as far as the treatment tab is concerned. The first option is to just print out a report for the patient. This is what it will look like. It has the name and the date of birth. It has the implant that you chose to be in there. It has the abutment that you chose to be in there. And that's certainly something that you can give the patient, and you can print it out. You can give it to the patient. You can forward that to the surgeon if you decide this is what I would like to have placed, or if you decide this is what I wanted to place myself, but then there's not enough bone there right in the position where I need it to be. And this is the area where I would like to have some more bone when you place the implant. That's the second page, so you can see all the different views of where the implant is placed. The other option that you have is if you want to go either with the classic guide or the OptiGuide, you can order it right from the website here. If you hit that button right there, we chose the OptiGuide earlier, so that's the order details that you have there. If you chose the classic guide, then it will just say that in the order there. The third option that you have is the one in the middle. In our case, it's dark. We can't choose it right now, and that's because that is the CEREC guide. So because we went with the OptiGuide, this is darkened out. But if you had gone with the CEREC guide as your option, that you wanted to go to just mill the guide in-house, then now certainly this option here will be available, and you export that file. And then when you go back to this button on your mill where it says export import, you would click that button, and instead of going the export route, you would then go with the import route. You would be able to plug in the exact way of how you want to go forward with the guide design. And then you would be able to go forward, and you would be able to manufacture button here, just like you would when you mill a crown, the same way you would be able to mill your guide right there. And that's the webinar. So I'd love to take some questions.
All right. Thank you very much. We've got about 15 minutes left if anyone has questions. We've got quite a few people on and no questions yet. So we'll give it just a little bit of time, and if not, we will wrap a little early. Oh, here is a question. Is the SSI file the same as OBJ or PLY?
No, so the SSI file is the file that comes from the CEREC. I'm not familiar with the other files. Are they from a different scanner?
Not mentioned, but maybe we'll figure it out. In the meantime, Dr. Conti, what is your favorite way to digitally restore the implants once placed?
So what we do at our office is we use the Atlanta system, which has been great for us. Essentially, the way that the Atlanta system works is once you have the implant exposed, you just place the IO flow in there, you scan it, it goes to Atlantis. And I'm always amazed at how quickly they can turn it around, because they will literally get our scan uploaded through Connect, and then we get the scan for approval within a day. They will send us the actual file for the crown, so we can use that and mill that just like any other CEREC crown that we can mill. And then they will mail us the abutment, and it's usually here within a week. And it comes with a little insertion guide. So it's almost like cheating. Makes it very straightforward.
To follow up on the other files, so they are open source files for color and texture.
So is that a file where you have already, sorry, Robert, is that a file that you have already designed the crown for at that point? Does the OBJ and the PLY file, do those already have a designed crown in it?
All right, more to come on that one. And then one more.
I'd be happy to, so Philip, I'd be happy to send you a PDF of the presentation if that's of any help.
And this webinar was recorded, so we will distribute that within 1 week of today, and you'll be able to watch back as much as you'd like.
But yeah, certainly if you just shoot me an email, it's right here. If anybody wants to have a copy of the PDF, a PDF copy of the presentation, I'd be happy to forward that.
Awesome.
Robert, I'm still waiting to hear from you. I will follow up. If you send me an email, I will follow up with you and try to get the answer to that. As far as I know, because we have the Primescan at the office, and we also have an Omnicam at the office. That's the only systems that we really use for that, especially with the CCAT suite. I think that's the only ones that you can import. But I will talk to the either the rep or the CCAT people if you send me an email, and I will get back to you. But I do think that the SSI, SIXD files are the CEREC files.
That is all the questions that I'm seeing. So I think we'll wrap a little early. Like Dr. Bringewald said, if anyone has additional questions, please feel free to email him directly. His email is on the screen. You can also email us at webinars@henryschein.com, and we'll certainly connect with Dr. Bringewald as well. If anyone would like to attend future Henry Schein webinars, visit henryscheindental.com/webinars for our upcoming schedule. And like I just mentioned, tonight's webinar was recorded, so we'll distribute that within 1 week of tonight. That's all I got. So thank you very much, everyone, and have a great night.
All right. Thank you very much.